Here at CellNetix, we have taken great pains to keep a tight focus on women's health issues. We have national experts in understanding pap smears and cervical biopsies and uterine and ovarian diseases. We have 10 pathologists who specialize in women's health issues, in particular in gynecologic pathology and in breast pathology.
So when the specimen comes to pathology and there's a problem in the female genital tract, it goes to one of our pathologists with an expertise in that area. So I think that we offer the ability for clinicians to send their cases to us and know that it will be looked at with the best diagnostic ability that we have.
The Pacific Northwest has the highest rate of breast cancer in the nation. We get to see a lot of it, unfortunately. But from the time a woman finds an abnormality or she has an abnormality found on her mammogram, the next step usually is a small biopsy. That biopsy would come to the pathologist and we'll review it under the microscope and make our determination as to whether there's in situ carcinoma, infiltrating cancer, or it's benign. And that will generate the next several steps, including additional imaging, a trip to the surgeon to get a consultation to figure out what's the best course of surgical treatment, and then on to the oncologist and radiation oncologist for follow-up therapy.
We see a lot of pap tests at CellNetix Pathology. There are several 100,000 at least per year, and the number does continue to grow. Our first procedure, of course, is always to scan the slide into our barcode scanner, and that allows us to accurately bring up that patient's material with the report. So it's always important to first verify patient name with the slide that you have. With the barcode scanning, that's all done for us automatically and allows us to have 100% confidence that we're looking at that patient's material. Then I will evaluate the slide. Our standard stain is an H&E or hematoxylin and eosin stain. I will evaluate it and then dictate a diagnosis which is immediately transcribed. I think more than 90% of our cases are signed out within 24 hours. Additional studies may be needed to be performed on cases. This is beyond pap tests now. Now we're dealing with tissue, but additional studies on tissue can be we need to look at further levels. We need to order special stains in order to identify any organisms that are there. And we may need to order immunohistochemical stains which can identify specific antibodies to let us know what specific proteins are present in the tissue which may correlate with the diagnosis.
CellNetix was born in order to provide better quality and shorter turnaround time for our patients. Our pathologists pride themselves in providing the best service to our clients, which truly are the surgeons and other physicians that are taking care of our patients. We are always available via telephone and email. Our clients know that we are always here for them, and they take advantage of that. They're always welcome to come and review materials with us. We all have double-headed microscopes so that we can show them what it is that we're seeing.
I think that all of us as pathologists will look at a slide and will personalize it to some extent. Think if it's close to your age, you of course think, you know, this is someone I know, or close to your mother's age or your father's age. So I think we all look at each case as if it were a family member.
We remember our patients all the way along. It's the reason, they are the reason that we made the investment in this company, in the building, in the laboratory, in hiring the best personnel. We didn't do it to expand, we did it because we care about the patients.